everyone. Today we are going to present create dialogue about postpartum lumbopelvic pain after cesarean section and the importance of combined physiotherapy rehabilitation.
After my cesarean section, I thought the recovery would be easy, but months later, I still feel pain in my lower back and pelvis. Every carrying my baby hurts.
Exactly, Sarah. This is a very common many women between 3 and 6 months postpartum continuing experience lumbopelvic pain due to muscular weakness, postural instability, and neuromuscular change caused by pregnancy and surgery.
Studies show that up of 50% of women experience this condition after cesarean delivery. The body goes through biomechanical change like increased lumbar lordosis, ligament laxity, and weakness of stabilization muscles.
Especially muscles like transversus abdominis, lumbar multifidus, diaphragm, and pelvic floor. These are muscles are essential for stability and movement control.
That explains why I feel unstable when I bend down or lift my baby. Sometimes I even lose balance.
Exactly. Many women develop compensatory movements patterns such as excessive hip rotation, poor posture, and incorrect muscle activations.
Recent evidence also found reduction in muscle thickness and delayed muscle activation in postpartum women with lumbopelvic pain.
Normally stabilizing a muscle active milliseconds before movement, but in women with postpartum pain, that activation is delayed, reducing spinal stability.
And C-section may also affect pelvic floor proprioception and coordination because cerebral trauma.
Although rehabilitation exists, many conventional treatments are limited.
My therapy mostly focuses on pain reduction and stretching, but I still struggle during daily activities.
That is one of the many problems. Traditional rehabilitation often treats the pain and stretching separately instead of the using an integrated approach.
This study proposed combining orthopedic manual therapy, pelvic floor rehabilitation, and lupopelvic hip motor control training.
The goal is not only reducing pain but improve movement, efficiency, postural stability, and functional recovery.
The research questions ask can a combined rehabilitation program improve postural stability, muscle asymmetry, and compensatory movement patterns better than standard rehabilitation?
The general objective is to evaluate the effects of the combined intervention in women under 35 years old with persistent pelvic pain after cesarean section.
Specific objects include assessing motor control and postural stability, implementing a 12-weekend intervention, evaluating change after treatment, and analyze maternal functional tasks.
So basically, helping women recover better and move normally again.
Exactly.
The theoretical framework explains how lumbopelvic region function.
The homopelvic complex were like a pressure cylinder, all muscles must coordinated correctly to stabilize the spine and the pelvis.
When other part fails, stress on lumbar segment increase, leading to the pain and dysfunction.
That's why isolated pelvic floor exercise are often not enough when we need coordinate neuromuscular retraining.
Combined interventions have shows better results than unimodal treatments, better pain reduction, better quality of life, better motor control, and improved functional performance.
This study will be a randomized control trial with pre-test and post-test evaluation.
Participants will be divided in two groups, a experimental group and a control group.
The experimental group will receive manual therapy, pelvic floor rehabilitation, core stabilization, balance training, breathing coordination, and functional exercise.
And what about the control group?
They will continue with a conventional physiotherapy, focusing mainly on pain management and general stretching.
The intervention will last 12 weekends with sessions to the 3 times per week.
Pain will be evaluated using a scale like BAS and MPRS.
Motor control and stability will be as a stroke. Active straight leg rise test, brain stability test, single leg balance test, and movement observation.
Functional alternate activities like lift with the baby, carrying objects, blending, and sit-to-stand transitions will be also analyzed.
So, the study focused on real life activities mothers do every day.
Exactly. Rehabilitation must improve daily function, not only muscular strength.
Finally, the study also includes ethical considerations.
Participants will sign informed consent form and confidentiality will be protected.
Interventions we will supervise by a qualified physiotherapist to minimize the risks.
Participants can withdraw from the study at any time without consequence.
I think this kind of research is very important because many women normalize pain after childbirth and never seek proper treatment.
That is true. Combined rehabilitation could improve the quality of life and help women recover faster and more safely.
Additionally, for the development of this paper, we used cloud-based AI tools to support research, and reading tasks include scientific information gathering, reading refinement, technology translation, and technical clarification. In this healthcare field, I'll finally analyze content, and conclusions were developed collaboratively by the authors.